Burnout is relatively a new terminology for India. However, for many countries, particularly for the industrial areas or for the management section, people have understood that burnout is a very common. And if you look at the statistics of the international firm, that's a Gallup Foundation, according to their survey, 40 to 60% of the people they suffer from this problem. Medical fraternity was very late in accepting that even doctors are also likely to get burnout. For many years, we believe that doctors are doing a great service to the patient, and because of that, they are protected, they are immune to burnout. But the study carried out in USA and other countries, they showed that even doctors are also not protected and they are also vulnerable to burnout. And today, I really like to congratulate Netflix for taking this very new innovative subject and bringing that to the doctors of India. So, with that, I would like to ask Priyanka the first question to explain burnout in a very simple word. But before that, she tells us in a medical terminology, I would like to give you an analogy, and that is a very day to day analogy. All of us have seen a candle, and what candle does? It gives us light. In the process of giving light to the society, to the people, what actually happens? It converts its wax into the light, but over a period of time, the candle shrinks. The same thing happens to the people, to the doctors, that they start their practice with a great idea that they want to help people, they want to help society. With time, with practice, something goes wrong. What is wrong, where it is wrong, that we are going to discuss. But something goes wrong in the process, and over a period of time, they lose interest from the practice. They stop interest in learning a new concept, new innovative ideas which are coming to the field. And that is, I understand, that is something what I understand as burnout. So, with that simple analogy, I would like to request Priyanka to tell us in a medical terminology, like what do we understand by burnout?
Okay, good evening, sir, and good evening to everybody, and thank you so much for having me. I think to begin with, sir, very wisely and rightly described burnout with the metaphor of a candle burning. And if I were to use medical terms with burnout, burnout is emotional exhaustion, it's cynicism, and it's depersonalization. These are the three pillars to use to identify burnout. But if I were to explain it to you to identify burnout and see how it impacts your life, think about your first day in medical school. There was excitement, there was joy, the willingness to read and learn, and you were so happy to be a part of this setup, right? You said, I am going to do it, I'm going to make my notes, I'm going to learn, I'm going to do the best I can. You were full of energy, excitement, willingness to absorb, 100% there. But now think about your last day of the semester or the last day of the year. Think about how tired you are, how exhausted you are, how you do not want to look at your books right now and you just want to sit in front of Netflix and watch TV all day long. So now at the end of the year, you're extremely tired, right? And then you have summer holidays and you have a break and you get refueled and recharged and you come back. But now imagine if you didn't have that summer break and you had to carry on day in and day out with that same exhaustion for a whole year more, how would you feel? Now that's the best way to understand burnout. Imagine the last day where you're fully depleted of energy and resources and you have nothing to carry forward, but imagine carrying forward that last day with nothing besides work to look forward to for at least a year, 2, 3, or indefinitely more. Now, I'm going to bring this a little closer to home, right? Interestingly enough, today happens to be a day where I've done two conversations about burnout. One is with you all and one is with the caregivers of dementia support group, right? Burnout. And I feel it's an overlap between doctors and caregivers. Because It's a profession where I have to lend myself to somebody else. I have to care for somebody else. I am not only taking care of their physical needs, but I'm also taking care of their emotional needs. Because let's be honest, when you go as a doctor on your rounds, you see patients suffering, you see them crying. There's a lot of emotions that you give them when you say, don't worry, I've got your back. Don't worry, we're doing the best we can right now. There's a lot that you're investing in that relationship, even if maybe a few minutes, but there's a lot of your emotions that go there. And you all are then entering a caregiver role as well. But now, if you're doing this every day and you're carrying that emotions with you, even post work, and you're not really taking a break or not having moments to refuel and recharge with no end in sight, you are going to feel tired, you're going to feel exhausted, you're going to feel depleted. And what this then happens is that the view towards life changes. You don't view life anymore with the rainbows and butterflies and the goodness that may happen. It only becomes, what is the point of this? Is there anything good that can happen? The cynicism, which I spoke about in the definition, that creeps in. Is it going to be purposeful? Will things get better? There's so much suffering in the world. There's so much of pain. What happens then? These are the kind of thoughts that come in.
When we joined residency, it is something like a new mobile. The battery of that mobile lasts like 2 days, 3 days, and then you use your mobile for 3 years, and after that you have to carry charger everywhere, and you have to go on charging your mobile now and then. So is it something like that, or it is different?
It is similar to that for sure, because what happens is when I'm burnt out, I'm running on no to very little resources. So imagine your batteries at 2% constantly. That 2% you're functioning, you can do the basic functioning on it. So it's not like the battery is not dead, the phone is not dead, it's still functioning, but it's only on 2%. So you're running on depleted resources, but there's a fear that that 2% may also collapse at one point. So you're running on 2% for a long period of time with the fear that I am going to lose my charge, and then what will I do?
At every lecture, I have got one comment. Then, Dheeraj, this is just a theoretical topic, and we don't see this in practice. Like, look at our friends, and none of our colleague is really affected with burnout. So, is it really true, or probably they are like in a denial mode and they are not ready to accept that burnout is real situation?
So burnout is very real. Let me begin by saying burnout is extremely real. It's as real as the table next to me. It is 100% real. But some people may not experience burnout because they are taking care of themselves. So everyone may not have burnout. Some may have burnout, but really depends on how you're taking care of yourself. Now, when I say taking care of yourself, yes, it's important to go on holidays, take a summer break, take that break. But remember one thing, that is not a lifestyle. What I do on a 1 week break or 2 week break is not a lifestyle. If I have to do 6 months of consecutive days of work, which is emotionally and physically draining for me, how will I show up recharged and rejuvenated every single day? And I'm going to say it's particularly important for doctors, because when you go and meet a patient, the patient is coming to see you. They want your undivided 100% focus attention on their health. There's a lot of responsibility in the role of a doctor. So if I'm running on low resources, I'm running on depleted resources, you're not only doing yourself a disservice, but you're also doing your patient a disservice. And I mean, I know everybody who's a doctor here today is a doctor because they wanted to enter the caring and helping profession. So, where I'm coming with is that, yes, everybody may not have burnout, but those who do have burnout is largely because taking care of themselves has to be a lifestyle choice rather than something you do only on weekends or only 2 weeks a year or one weekend every 6 months. That's not how it works. It has to be something you do regularly every day.
Okay, so before we come to the question of what actually causes burnout, I just would like to know from your experience, like, is it like one specialty or one branch of medicine is vulnerable for burnout and others are not? Is it like that, or like you have seen all the doctors, all the branches of like doctors of all the branches having problem of burnout?
Um, how do I put this? if everyone is susceptible to a cold, if I take care of myself, I won't get a cold. So yes, all branches of the fraternity are likely to have have people who have burnout, but data says those in nephrology, urology, and
Neurology.
neurology. Yeah.
Right. Okay. So let's come to a direct question, like why these branches are more likely to get burnout.
So when I'm looking at it, this is what data says, research says it. And why these branches are probably more likely to experience burnout is probably because of the intense workload they have, the need to deliver, the less likely to get a break, the high demand, the high stress, constantly being on call. These are factors which likely to influence it. However, I have to say something that one of the categories where people were least likely to get burnout was surgery. I think it is also likely the way the work structure is designed for doctors in different fields that influences this. Those who are on call most of the time, who have a high workload in terms of patient expectations, a lot of pressure on themselves to perform, upskill.
So every now and then we feel that, oh, these symptoms can be of COVID. So first of all, like we should like to understand what are the symptoms of burnout.
Okay. So, when I think about burnout, the best way to describe it is that you constantly feel fatigued, tired, really low on energy, and this doesn't happen for just a day or 2 days or 3 days. It's a persistent feeling over a period of time. You've been experiencing these symptoms for more than 3-4 days. You tend to feel helpless, hopeless. You question what you're doing and why you're doing this. The perspective towards life seems very dark, very gloomy, almost that, I don't see any reason, my effort is immaterial, nothing will amount to it. And when Sir began this conversation, he said, it's so nice to see all you participants here because you're investing in something above your neck. And the truth is, what happens when we're in burnout or we're very tired, we invest in our stomach a lot more, or we tend to ignore our stomach a lot more. Obviously, there are changes in our motivation levels because of that tiredness, that fatigue feeling. In addition to the fact, there's also you feel disturbed sleep. You also not really see the purpose of doing anything and not want to do something.
Okay, so like I at the end of the day feel like when I come home physically I'm tired. Is it like my nature, or and this is for last 10 years, so it's not like that this is recent in origin. So do you consider that this could be a
So no, this is not burnout. And the reason why it's not burnout, because you wake up in the morning fresh, you wake up in the morning rejuvenated, and you wake up in the morning rested. At the end of the day, you're probably tired because you have a demanding role. Your job is demanding and you're interacting with so many people. So yes, your resources are depleted at the end of the day, which is normal and natural. But you're still viewing life as purposeful, even at the end of the day. Maybe you don't want to engage with too many people, but you're still engaging with some people. In burnout, I can start my day and end my day feeling as tired, if not more tired.
I'm really, or like all of us are really interested to know about the cause, because unless and until we know the cause, what is actually causing burnout, we are not able to understand the pathology, and we are not able to understand the preventive strategy. So, what actually
Okay.
causes burnout?
What causes burnout is the way we're living our life, in a nutshell, if I were to say that. It is the kind of pressure you're putting on yourself to perform, the expectations the society may have of you, or the expectations you have of yourself. This need to constantly be productive, the need to constantly deliver, and just grinding yourself with work non-stop and only viewing life from this one-dimensional perspective of I have to deliver and I have to work, and that is what causes burnout in a nutshell. The cause of burnout is the way we live our lives where we're not taking care of ourselves. And the reason why I'm saying this is because, see, here's the one thing. I have to work. Work has to be a part of my life. But how I work directly impacts the quality of work and the quality of life I lead. If I'm not working in a balanced way, and I'm not taking time for myself, or I'm not taking time to nurture myself, more importantly, I will burn out. So the cause of prevention is probably the same. It is the same answer, and the cause is the way we are living our life with high expectations, a need to constantly deliver, and constantly being productive at all times. But productive not from a point of view where um, I can just be productive in terms of painting because I enjoy it. No, being productive from a point of view where I'm pressurizing myself to deliver high quality work at every single moment.
And if you look at the like city like Mumbai or Delhi, in that case probably it is more than that. So these many long hours of working is responsible for burnout.
That's a very tricky question. I'm going to tell you why I think it's tricky, because I love working. I think working, and I love what I do. So you will find me at work at 8 o'clock in the morning and I'm still at work and I'll have an hour more of work, okay? For example. But the thing is that I'm also taking, so you can work as long as you feel the need to work. But are you also taking care of yourself while you work? That's an important question. See, understand, people have needs that we are in a role to cater to, in a role to take care of them. But despite the fact that I may work some days 9 hours and 12 hours, in those days or on those days, am I taking time to take care of myself? Are my needs being taken care of? So my need would probably be that I want to go for a 20-minute walk. Am I still taking time out for that need of mine to disengage from everything else and just focus on myself? Am I still engaging with my friends every week or like every day? What am I doing in addition to work directly impacts the kind of burnout I'm experiencing. So if I'm only working and I'll go back home and I open my books and I study some more and then I just watch some more like videos on this, I'm only becoming one dimensional, and that will lead to burnout because I'm not looking at anything else. One of the ways to cope with burnout is constantly giving yourself a fresh perspective towards things, that is constantly disengaging and then re-engaging. It's like you have a car, right? And it runs on fuel. Now, I have taken the car all over the city and the fuel in the car tank is over. I have to refuel it. And it's important to refuel it with the fuel that suits you most. So for me, what really suits me is listening to music and walking. I love it. That what fuels me the most. So that keeps me disengaged and gives me the energy to go back towards it. Also, talking to people from different schools of thoughts, different perspectives is what engages me. And that really helps me cope with the stresses and demands of my job. So I don't necessarily believe it's the number of hours that you give to work.
Right. So before we go for preventive measures, I just would like to check: is it the group practice or a solo practice? Is there any difference in the burnout rate?
So I'm of the opinion that any activity where I'm doing alone for myself in terms of a job can be very isolating. And if it's isolating, it's going to lead to loneliness, and that's going to lead to a lot of other symptoms which may look like depression or may look like anxiety and definitely lead to burnout. So even if my practice, for example, is an individual practice, am I making the effort to connect with professionals from the same school of thought to engage in conversations about it, or others that really helps you cope with the stresses of work? So even if my practice is individual, you need to carry that extra load to connect with people in the same profession, because that in turn lightens your emotional load with your work.
Okay. Before we proceed, there is a question from audience. Mahadev Bhai Desai has asked, I love working. I feel exhausted and annoyed when I am not working. So, like, is it the like surety that you are not burnout, or it's
So
not?
it's great that you love working, and I think you should keep investing in your work. But remember one thing: work is a part of your life. It is not your entire life. What else are you doing for yourself in your life? You can't just grow one part of your life, because if you might be in your 20s now, but imagine if in your 40s, what will you have to show beyond work for yourself? And I think I'm going to bring a bit of research in dementia over here. It's stated that people who have hobbies throughout their life, for them, if they are diagnosed with dementia, they cope better with it because it still gives them something to focus and engage on. So where I'm coming with, great, love your work, keep working, don't stop working. But what else are you doing in addition to work? That directs your quality of your life.
Okay, and then like the recent past, like we all passed through a very bad phase of COVID. And do you think that what is the effect of this pandemic on burnout? Like my colleagues in USA, they say that yes, COVID has a very negative effect on burnout. Do you see that such effect in India?
I definitely. I think something I'm seeing with a lot of my clients and also with doctors is a lot of existential questions are coming in. What is the purpose of my existence? What is the meaning of my existence? Why am I doing what I'm doing if eventually things are going to result in this? It has had a very significant impact with burnout as well as post traumatic stress disorder, especially those who are frontline workers in the first wave, because of not knowing what to do, how to manage it, what was going to happen moving forward. There's a lot of data that suggests that it has affected the mental health of healthcare workers across our country. And besides, I think the fragility of life came into question, more so than ever before. I think as doctors, the death is something we confront every day, but the way it hit us last year and not knowing what we can do to prevent it or to manage it.
So let's now move on to the most important part is how we can prevent it. Because what you said is about the causes, but how to actually prevent it. So let me tell you, like the remaining time of this webinar, we are going to spend for prevention and treatment. So before we come to the treatment, I will ask you about how to confirm the diagnosis. So like these are the three areas which now we are going to discuss in remaining time.
Okay, to prevent it, I think you have to first be very aware of what your experience is every day. So don't mindlessly live your life, mindfully live your life. And this may sound a little cliche, and I apologize for that, but it's the truth that if I'm going to go about my life and my routine and my work, just filling out reports, filling out forms, having basic conversations with people, and not being aware of what my experience is with my day, you're mindlessly living your life, and you will miss a lot of the signs and symptoms that may suggest deteriorating mental health or emotional health right now. So you begin by being aware of yourself. Now, to be aware of yourself, what can you do? It is notice the way your body physically reacts to things. So, if you notice a constant backache or a headache or stomach upset, figure out when does this happen and why does it happen. Very often, this is great insight to understand how your emotional health is doing. If I constantly have a backache and it's not because of my posture, really ask yourself, what burden or load am I carrying? If you constantly feel confused or lack of clarity of thought, really introspect and say, what is overwhelming at this moment? If you notice you're grinding your teeth very often or you're clenching your fists very often, there is some amount of anger you're carrying, some amount of stress you're carrying. So notice the physical signs in your body, best indicator to notice your emotional state. Second, which is my favorite, journal. Take a few minutes out every day, and I know it's a difficult activity to do, but if you start with like say 5 minutes and then build yourself up to 50 minutes of journaling every day, really helps you understand what your thoughts are and how it's impacting your daily existence. Um, so when I'm looking at preventive, I will first begin by becoming aware of it. And the other signs in terms of becoming, apart from the general everyday awareness, is notice your eat, sleep, and exercise. I say it every time I speak to anybody about good mental health, but these are your three pillars of mental health care. If you notice any changes in any one of them, it's an indicator again of deteriorating mental health. So if you're sleeping too much or too little, eating too much or too little, or not feeling like exercising or over exercising, yes, your mental health is getting affected, and it's time for you to take a step back.
Like doing too much of exercise, that's something really not understandable, because how it comes under the area of lack of mental health.
So I'll tell you one thing. What I've noticed in people who are angry, for example, who are very stressed, right? They may either completely avoid exercising, or they will punch the punching bag in the gym harder, or they'll push themselves harder on the treadmill, or they lift more weights. Be aware of these things. It's just an indicator that something's not right somewhere, especially if it is not part of your plan. Now, the reason why I'm saying this is because everybody wants to punch the bag harder in the gym, everybody wants to run faster on a treadmill and lift more weights. But there is a way your body also gradually grows to that kind of level. That resilience is built over time. But if I'm suddenly going from not running at all on the treadmill to now running for 15 minutes on the treadmill, that's a bit of a worrisome. How did you suddenly fill up all that energy? It's probably coming from pent up frustration and anger and stress. While it may be a good way to release it, it's important to also address the core factor in it, address the fact that you're feeling stress, address what's triggering the anger, rather than just allowing it to be there and take it out in the gym. Okay, I'm going to read this question which is asked: how do you convince someone that she is experiencing burnout? Acceptance is the first hurdle usually. I completely agree with you on that. Acceptance is the hardest part for anybody with deteriorating mental health, because all of us think we're superheroes, we can all manage everything, I've got this. The truth is that when somebody is experiencing any sort of deteriorating mental health, including burnout, my first thing to do is just empower them with information. I don't tell them this is what you're experiencing, this is what is happening to you. I don't. I just say, hey, I read this article, why don't you read it? And I will share a couple of articles with them on that, and then later on have a conversation about the signs and symptoms and if they relate to any one of them. Or I will say, even nowadays I started feeling this way, do you feel this way, to kind of begin the conversation about it.
What happened recently, before few minutes, was something like some unwanted event. This was not planned. So a lot of time we face such unexpected event like a complication. Some patients become serious which you were not expecting. So does such event really creates uh, like rapid onset of burnout or not?
So when I'm looking at an event which could be a stressful event, I'm going to give you two examples. Either one, a person has a relative or a close loved one has met with a very severe accident, and now that has resulted in a significant change in the family setup. Or two, somebody you love has been diagnosed with dementia, and dementia, as we know, is not a curable illness. It's something you have to live with for the rest of your life. So it's obviously impacting the way the entire family dynamic is. Now, in situations like this where I'm thrown into a deep end, in that moment or in the short term, I am firefighting. I'm just trying to figure out systems and structures to manage and maintain the process. But firefighting can happen 1 month, 2 months, 3 months, and I'm going to say pushing it, unfortunately, maybe maximum 5 to 6 months. Maximum, because sometimes I understand things really will take a long time to kind of get streamlined. But even after you are streamlined and you are still experiencing the fatigue, that helplessness and exhaustion, then that's burnout. And then that could look like caregiver's burnout. And I'm going to bring in another thing over here with caregiver's burnout. One of the key factors also is guilt. Because how can I not show up for that person I love? How can I not show up for my patients? What will happen if I'm not going on rounds today because I'm not feeling well? Then that guilt sets in. And guilt is a terrible motivator to get you to show up in places when you don't have the energy to. It's something which I don't think is widely discussed with burnout, especially, but I'm bringing it into the factor because we're talking about, in a way, doctors and caregivers and how burnout impacts their life. And I think guilt is a key component in it. But if a stressful event has happened and I'm firefighting, I understand that for a short period of time, but things need to get streamlined. And even after being streamlined, I'm still experiencing exhaustion, then that's burnout. And a key contributor to that burnout is likely to be guilt. Guilt of not doing enough for the other person, but then also feeling tired and fatigued and not having energy to do it.
This condition requires a proper diagnosis, because without that you can't go for the curative options or preventive options, like that is for everyone. But for curative options we need to have a proper diagnosis. So how do we diagnose burnout?
You look at the signs and symptoms, which is again continuous feeling of exhaustion, continuous feeling of being tired, feeling purposeless, feeling demotivated. Even though my minerals even though my vitamins and all are in place, I'm still feeling lethargic. I'm still feeling fatigue. I'm struggling to stay focused. I'm making a lot of careless errors. I'm repeating mistakes. I'm attending classes, but I'm not retaining any information shared with me. And this is happening.
The diagnosis is made by the blood sugar. So there is a difference between the symptoms and the test for the diagnosis. So similarly, burnout, what you describe are the symptoms. But what do you do for the diagnosis?
So there are assessment tools we can use for diagnosis, but they're largely pen and paper assessments. So there's no really a blood test we can do to diagnose if somebody has burnout or not. It's more so we understand their emotional experience at that point of time and then work within that apperception test like projective techniques to understand the emotional experience that helps them with it.
Okay,
So that's what we use.
yeah, like say I'm not right, like remember the word exact, but there is probably a Maslach test which is used for the diagnosis of burnout. So do you use that in your practice, or it's a self assessment test?
So right now, to be honest with you, I usually work with people and their symptoms and use coping skills with it. If I have to look at something more significant and more severe, I would use the MCMI and look at their symptoms of depression and their personality to understand what their emotional experience is at that point of time. I would also couple that with the thematic apperception test. I think is a very useful assessment, especially with projective techniques, because it gives you insight into their subconscious behaviors, their needs, their desires, their stressors, and putting everything collectively. Then I would.
Okay, so yes, now we come to the most important part, and what are the treatment options available?
Okay, so
Are the
treatment.
preventive options are the same for the like treatment options, or they are different?
So it depends on what level of burnout you've reached, right? So tomorrow, if I'm extremely burnt out, I have no energy, and I'm going to start using preventive measures to do the treatment, it probably won't work. At that point of time, I would need to completely disengage for a significant period of time, and then rejoin what I'm doing. So every time the preventive measure may not work as a treatment measure, you need to be aware of that. Preventive is there to ensure the severity of the symptoms don't take place, so symptoms don't even show up. But now the symptoms have showed up, I then need to disengage from my present functioning, my present situation, regroup, reground myself. And how do I regroup, reground? It could then be eating right, eating healthy, good sleep, talking about my expectations from myself, my pressures, learning to manage them better, finding a more effective schedule that's reflective of my needs in terms of professionally and personally, and then gradually ease back into work. That is how the treatment plan would look like. Where I would invest more time is also understanding how did I let it get to this level.
Right. Okay. Like in USA, there is a new trend which is coming up is a compassionate care. Means like you try to understand the emotion. That is again like say empathy related training. So you try to understand the emotions of patients. You try to put yourselves into their shoes, and then you try to help them out. So this is one approach which is currently recommended strongly in USA, that this is probably a good vaccine against burnout. On the other hand, I remember that during my training days, my professor used to say that don't get involved with patient too much. If you get involved with them too much, then probably you will understand or you will imbibe their sorrow, their pain into yourself, and then probably you get exhausted very fast. So now there is completely two different approach. One says that don't involve with patient, the other says that you try to get involved with patient. So what do you suggest?
So I'm a psychologist. I'm biased over here. I'm very clearly biased. A big part of my job when I'm with a client is, and as Carl Rogers said, when we're in therapy with a client, we lend our clients our ego. So I'm clearly of the school of thought that I empathize with my clients because, but I'm also going to say I empathize with my clients, but I also know how to disengage from a conversation with my clients once I'm done speaking with them. So yes, I do believe you need to empathize with your clients because that makes them feel understood. So the rapport is built and they're more willing to share with you their experience in terms of physical symptoms, what's triggering them, why they had unhealthy behavior patterns that led to this. And as a result of which, once they leave the treatment or once they are on their treatment path, they're more likely to comply with what you have said. I know compliance is a very big problem with patients, and probably it's because trust comes in, rapport comes in, knowing whether my doctor has truly understood me or not, and these are very big factors. So I'm clearly of the opinion, yes, you should empathize with your patients, your clients, but you also need to learn how to disengage after each conversation with a patient. That is extremely important, because if I am not disengaging,
You have to like cut the conversation, means you have to cut that call. So that is very well from the theory point of view, but how to do it in practice?
So I'm going to one begin by saying practice makes you more capable of doing it. I'm honestly going to say that. Two is I recommend that everybody actually speaks to someone about their emotional experience every day. Everybody has emotions. Everybody is experiencing it differently. Everybody is dealing with different kinds of trauma every day, and it's going to impact your life in different ways. You should speak to somebody because it really helps you cope with it better and disengage from situations better. Three is you need to engage in an activity which requires you to mentally disconnect from what you did the whole day and actively engage in something. So I know a couple of doctors at Holy Family Hospital who make it a point to go sailing very regularly. Because they find that therapeutic for them. They find it comforting. This is an activity they've chosen to help them unwind and de-stress with it. Um, Choose an activity you can do every day which requires mindfully engaging in. And I'm not talking just like cooking, which some basic recipe you do every day. No, nothing like that. Talk about mindfully doing it. So even a game like Sudoku, something I love to do.
Okay, and then very another important question, which is time and again people ask, and people see meditation as a panacea. They consider that all mental problems are taken care by meditation. So, what is your views on meditation and burnout?
Okay, so I do like meditation, but I am going to tell you it's not meant for everybody. At different stages of life and at different ages, that's when you need to begin the process with it. I also want people to understand that if I meditate today, I don't become like a yogini tomorrow. It is a journey of discipline that meditation actually teaches you more than anything else. I mean, I can go on about meditation, and I'm going to try to hold myself back with it. But meditation is good, but when you're meditating and how you're meditating is more important. So if somebody has high anxiety and tends to spiral, if they are left alone with their thoughts, they are going to spiral. So it's not going to be a very calming process for them to meditate. Perhaps then they should try doing meditation in a group which is guided, right? So how I'm meditating, what I'm doing. For example, the practice of Vipassana, which is a meditative technique, that could be extremely difficult for somebody who has depression, because you're left alone with your thoughts, you're not talking to anybody for so many days. It's going to make you feel more isolated than before. So what you're choosing to do and when you're choosing to do which meditative practice, that's very important for you to identify first. I'm also going to say meditation essentially means oneness with yourself. Identify what practice suits you, your intent for yourself, and helps you become more aware of your emotional experience every day.
There is another school of thought that if you find a meaning of your life, why you are on this planet Earth, does it give you the protection against burnout?
Okay, it's a
A,
very
a
layered
bit
question.
difficult question.
No, but so the reason why I'm going to say it's actually a very layered question because we're entering the school of existentialism right now. So I'm going to try to keep it as simple as I can while we address this. The meaning of my life should have meaning in what I'm doing in the now. And if you have meaning in what you're doing in the now, you are very likely not to burn out. Because when I'm choosing to take care of my patients, I know it has meaning for me in the now, as opposed to saying I'm going to take care of my patients and then eventually I will think of myself as a very good healer and a caregiver and a healthcare worker. No. The minute you stop enjoying what you're doing or you're struggling to find meaning in what you're doing, that's an indicator then that you're heading towards burnout. So, yeah.
Okay, and then another question that a lot of people say that from their practical, not from practical, but their thinking that taking a vacations at every 2 or 3 weeks or every month is a prevention for burnout. Is it so?
I'm going to sit here and say, well, if you can take a holiday every 3 weeks, you're extremely well
Lucky.
resourced with money. Okay.
Money,
Because
right.
vacations every 3 weeks I know is very expensive. But on a very serious note, that is, I mean, if your lifestyle says if your job says vacation every 2 3 weeks, great, superb. But I don't think that's very practical. If I'm engaging in something for 3 weeks and I feel the need to run away, in the fourth week, that's not healthy. You can take a holiday every 4 weeks if it's great and if your finances allow it and you want to do it, superb. But why are you taking a holiday every 4 weeks? Is your reality so difficult to cope with that you need to take a holiday every 4 weeks or 3 weeks? And if it is difficult to cope with, you need to then sit down and confront your reality and ask yourself, what is so difficult in my reality, and address it.
Okay, and then there is another practical question that doctors who are having a very good practice. A last thing before we take the audience question, can you quickly summarize what are the tips you would like to give it to our audience about prevention of burnout? Because we
Eat,
don't
sleep,
know that
exercise.
how many of them are affected with that. We don't know, but prevention is going to work for everyone. So a quick recapitulation of like what we discussed.
My favorite, and I begin everything with eat, sleep, exercise. These are your three pillars. Invest in these three things heavily. I did enjoy the question about meaning and that existential question, but if I'm finding meaning in what I'm doing right now, I'm more likely to be actively engaged in my day and therefore less likely to burn out. The fifth and most important thing is that you need to ensure that you are enjoying your activities and not working from an end goal point of view, but viewing your life as a process and a journey. So it's a marathon. What am I doing to build that resilience for the marathon rather than looking at just completing tasks and coming out as a winner? So be aware of these five things and notice the physical signs and symptoms. Sometimes the struggle to be emotionally aware at all times, then that's when you rely on your body, because the body never lies. It's a great indicator. And lastly, identify your needs and ensure you take care of your needs. Everybody's needs are different, so you need to spend some time introspecting and identifying what yours are.
Okay, thank you. Like before we end the session, there are a few very good questions, and one of them is like I am confused with depression and burnout.
The symptoms overlap. Helplessness, hopelessness, and worthlessness, which is likely it's there in depression, is also there in burnout. A lot of symptoms in anxiety also overlaps with burnout. So symptoms may overlap, but I'm going to say the key factor over here is that even after, it's the purpose. If I'm questioning the purpose and to what extent I'm questioning the purpose really plays a role over here. Also, I mean, even tiredness and fatigue is in depression as well, it's in burnout. I think what happens for you to clearly identify the two means you have to add more context to your emotional experience to know, am I experiencing depression or am I experiencing burnout? It's the context surrounding it.
Then there is another practical questions. I really appreciate that question. That if you feel that your colleague is suffering from burnout, how to convince them to take help?
You know, I answered something similar to this before. It's very simple. You empower them with information. You will not go to your colleague and tell your colleague, I think you have burnout, because like I said, your colleague will turn around and tell you, you have burnout, I don't have burnout. So empower them with information and try to have healthy conversations about it, and let your colleague identify themselves and resources for them to take care of themselves. But remember one thing, don't push it down their throats, because if you don't
See,
treat
this is very
burnout,
similar to the question that why we really need to treat diabetes, because if you don't explain that to your patient, they will not follow your suggestions, they will not follow your treatment. So the first important thing is like why we really need to treat burnout.
you know, when I look at why I need to treat burnout, I think about days when I'm extremely tired and how terrible I feel about myself and how I don't like it. And imagine if you're going to feel that way about yourself every day over a long period of time. Is that something you want to live with? Now imagine the day when you're high on energy, you're productive, and you're doing good work. Which day would you prefer? Naturally, the second one, when you're high on energy. Now imagine living your life like the second option, high on energy, versus living your life like the first option. I mean, it's very obvious that you treat burnout because your quality of life, your productivity, your quality of relationships is significantly better. And besides, you will be able to achieve much more with your own life. You will be able to find that meaning to your existence and actively pursue it every day. I think that's the best sales pitch I can give on why you need to address burnout.
Okay, yes, and just I would like to add, it has been studied very well and documented very well that the doctors who are burnout they are not able to satisfy their patients well. So their patients are more dissatisfied with them. So this is something like it's not drinking is bad for you, but drinking is bad for others also. So similarly, being burnout,